Well, the CDC that the now PM promised us when he was opposition leader back in 2020 was one which would deal with infectious diseases like COVID, but which would also deal with chronic illnesses. So 9 out of 10 deaths in Australia are related to chronic illnesses like cancer, diabetes, cardiovascular disease. But the CDC that we're proposing to set up right now won't deal with those until after 2028 at best. At this point, it's not equipped or funded to deal with things like the health impact of climate change, and the government doesn't intend that it will look at things like preventative health strategies yet as well. And we know that we've got equivalent of epidemics of mental health issues, for example, the social media issues that kids are dealing with, the major issues that many people are experiencing with mental health problems related to gambling harm at the moment. These are all things that the government doesn't intend that CDC will look at until 2028 at the very earliest.
So what
we've got
will
no
it
guarantee of it doing it then.
What does it start by looking at?
Well, at the moment, the government's guidance, such as it is, which is pretty limited, is that it will focus on communicable diseases or infectious diseases, but it has taken out some of the other things that were initially intended to be in the CDC, which included things like the National Medicine Stockpile. All of us will remember the summer of 2022 when we couldn't access PCR testing for COVID for love or money. We couldn't buy rats. Hospitals didn't have PPE. The government was struggling to access the vaccines that we needed. All of those things were part of the National Medicine Stockpile, and the government is now taking that out of the CDC as well. So I think in terms of, even if we're just talking about infectious diseases and pandemic preparedness, the model CDC that the government is proposing is inadequate, and I've got real concerns about it.